This slide shows an example of how population health works. And so the first thing you have to do is use your electronic health record to define the population. And this is the idea of finding all of your diabetics, for example. And then the next thing you want to do is identify any care gaps in their care. And so, for example, with diabetics, you'd expect them to get a diabetic foot exam every 6 months. And so you need to be able to look at the electronic record and see if that's been documented. Then once you do that, you want to stratify these risks. So it could be that you haven't had a diabetic foot exam, you haven't had a hemoglobin A1C, and maybe your blood pressure is a little high. And so someone has to make an algorithm that'll say what the most important thing that needs to be done is, and then try to make a list of those patients so someone can intervene. And that because we have to try to engage the patients in that task. And so what we want to do is we want to call patients or bring them into the clinic when they haven't had appropriate screening tests or appropriate medications done. This is similar to what your veterinarian or your dentist does when they call you. And usually we haven't done this in healthcare. We've just waited for the patients to come in and then tried to take care of them when they get in. And then once we do that, we have to manage the care. And what that usually means is reduce the price. So we have to be able to do this in an efficient and effective way so we get all the patients into the screening in the most efficient way. And then we want to measure the outcomes. And measuring the outcomes is we'd like to know what percentage of our patients have the appropriate screening tests. It'd be nice if we could show that by getting those screening tests, we've actually reduced the number of hospital admissions or the number of visits to the emergency department. And that's sort of a rough example of the population health cycle.